Mr. Garrett is recognized in opposition for 10 minutes.
If it were only as simple as that. The American public realizes some things are simple, and that is the fact that they look at Washington and realize that the system that Washington has created and managed for several decades is not being managed properly. American public realizes that with the systems that we have here, Medicaid and Medicare and Medicaid, that Washington can't even figure out how to pay for those systems. And yet here we are about to enact a brand new, larger program that we have no way to pay, and also that now we're going to be in meddling and entangling ourselves in the whole area of the private sector when we can't figure out how to run our own system. Now you talk about what the states can do. Well, the states, each of the 50 states has the authority under their constitutions to go in and set up the parameters as far as regulating, should they so choose. You said as far as California is concerned, California has that authority already, and they have to go before a rate board that's there as well. So what is it that you're actually trying to do here? What you're trying to do is to say, well, we have a federal government system where we have people who are on Medicare and what have you right now are finding it difficult in order to get doctors. We know that people are on Medicaid who are finding it difficult to get pediatricians because of the rates and what have you. Now we're going to put the same similar system with private sector. Create a health insurance rate authority to basically impose price controls on insurance plans. And when you think about it, I think this really shows the fundamental difference between the Democratic approach and the Republican approach to health care reform. Mm-hmm. You know, several measures in the Democrats' health care overhaul call for the government to limit patient choice and restrict competition. Now, how do I say that? Well, at the beginning of the hour, someone on the other side of the aisle said, well, we want to have a fact check on this. Well, let me give you some facts as I go through this. In addition to the Health Insurance Rate Authority, the government-controlled price-setting board, the Democrats propose, 1, expanding the powers of the U.S. Preventive Services Task Force. This is a board that recently made, as the gentleman from California talked about before, a very controversial decision regarding mammograms. Where can you find that? Well, that was in Section 4003 of the bill. What else do you want to do? You want to create a new federal coordinating council for comparative effectiveness research. Where can we find that? Well, fact check. Center for Competitive Effectiveness, Section 1401 of the House bill. And what will this do? This will decide which treatments are worth paying for and which ones of all these little stories that we heard the government is not going to pay for. What else do you want to do? You want to establish an independent payment advisory board. And where can we find that? That's in Section 3403 of the bill. What do we want to do there with your legislation? You want to fast-track cuts to the Medicare program. The very same seniors who are having a difficult time finding doctors to provide the services, you want to be able to provide fast-track cuts to those programs. And finally, you're giving the Secretary of Health and Human Services unprecedented powers, as a ranking member has stated before, to make payment decisions and change the requirements for acceptable coverage. So what are the results of all these things we're trying to do? These measures basically will take away the ability of doctors and their patients to decide together what is best for the patients. This is an infringement on the most personal decisions Americans can make, an intrusion on the doctor-patient decision. What you want to do, it seems, is to put the government in charge of health care decisions, and by doing so, what will be leading to? Like we heard outside experts say, they use the word rationing. Rationing of health care, ensuring that options are controlled entirely by the federal government. Individuals and families no longer will have the ability to choose any health plan, they say. Gentleman from California made that point, I think, very well before. If the plans are not out there anymore, then we no longer have the choice to choose the plan we currently have. So regardless of patient needs, the government decides what is best. These policy limitations will also affect competition. Now, it would seem that your side of the aisle would come up with the same talking points, but we haven't seen it here. Is competition a good thing, or is it not? We heard from Mr. Doggett that competition will be helpful. But I heard from my colleague from New Jersey that said competition is not going to solve the problem. So which argument is correct? I'd like to hear what the answer is.
Would the gentleman yield, since he used my name?
When I'm done. Thank you.
Okay.
We would believe that competition will be beneficial. But at the end of the day, the language that you have in your legislation will do away with competition. We need to reform health care while encouraging competition and innovation, ensuring that individuals and families have the widest range of high-quality health care and all available to them. And with that, I would like to yield the balance of the time, or such time as you consume, to the ranking member.
I'm glad